If you're thinking about getting a hair transplant, then there's a few critical things you need to know before you make possibly a costly mistake and make sure you get the best results. In this video, I'm going to break down things like cost, the techniques used, safety elements, the recovery and the possible results so that you can make an informed decision. Before we crack on, make sure you do subscribe so you don't miss out on any of the information I release regarding hair transplants and hair restoration in general. And if you're considering getting a hair transplant, then book a free consultation with me using the link in the description below or Googling Royal Wolf Clinic in order to get a free consultation for yourself. So before we crack on, let's first start with 5 must-know facts regarding hair transplant. So the first one is your surgeon can only work with what you have. Remember, hair transplant is a transplant, which means we are moving hair from one place to another. So if you don't have any hair or if the donor area is extremely compromised, then a hair transplant might not be the best thing for you. Secondly, your transplanted hair is normal hair. After a transplant, once it's healed and it's started growing properly, it can be treated like normal hair. You can wash it, you can cut it, you can style it exactly the same way as your normal hair. There's no differences. Thirdly, the results are permanent, and there's a reason for this. So you know, for most people that get hair loss, typically for men, they end up with this horseshoe shape around the side of their head where they're losing hair in the middle. Well, the reason for that is that for some reason, the DHT, meaning dihydrotestosterone, concentrations in the scalp are really concentrated in this middle area, and the hair there is actually quite vulnerable to that. Whereas the DHT concentrations and the hair in the back end of the donor area, which is typically around the sides and the back of your head, they're actually either completely immune or highly resistant to DHT. And that's a quality of the follicle itself. So when you move that follicle from the back to the front, it maintains that immunity or that resistance to DHT, which means those results, that transplanted hair is permanent, should not go away. Fourth, the right clinic makes all the difference. So if you're going for a cheap clinic or a clinic that's not very well reviewed or the results are not very good, that can actually end up costing you more overall in the long term in order to repair any issues that have arisen from that transplant in the first place. It's always a good idea to do your research before you crack on. And lastly, and this is the thing that usually gets people, results do take time. So full results are typically within 12 months to 18 months. And you do see the hair growing before that time, but full results happen around 12 months in, which means there's a bit of time to wait before you can actually enjoy your new hair. So nextly, not everyone qualifies for hair transplant surgery, unfortunately. There's a few criteria to go through to know if you're a good fit and whether or not it's suitable for you. So firstly, you have to have hair loss. It goes without saying, but we don't do hair transplants on people that don't have hair loss going on at all. So you need to have some form of loss before we consider doing the transplant. There is a scaling system that we use. It's called the Norwood-Hamilton scale. This goes from a class 1 all the way up to a class 7 or class 8 on the scale, which helps quantify and talk about the degree of hair loss that you're experiencing. Secondly, you need to have a good strong donor area. Donor area meaning the back of the head and around to the sides just behind the ears as well. It needs to be nice and thick and ready in order to extract enough hair follicles to actually make some result on the front. You can go with a compromised donor area, but the problem with that is you might be left with significant thinning and scarring in the donor area, which doesn't look good long term. Lastly, you need to have realistic expectations. We're not going to be able to turn everyone into Brad Pitt. Okay, long flowing hair like that might not be possible for everyone, although we will certainly try. But we need to have good expectations about what the actual result is, what the health of your donor area is, what number of grafts are reasonable to extract, and how this will actually look in the long term. And that's why you need a pretty good surgeon or a good clinician to walk through this with you to set your expectations right for the eventual long-term result. Let's talk a little bit about the cost of a hair transplant. So my clinic is based in Docklands in London in the UK. Typically, at the moment, a good quality hair transplant in the UK will cost you somewhere between £3,000 to £6,000 depending on the degree of hair loss. Obviously, bigger surgeries will probably require a bit more payment in order to get that done. The main factors that are going to affect that cost are going to be the clinic you go to, their reputation, their experience. Very experienced clinics with very good reputations tend to charge higher prices. The number of grafts you need is going to make a big difference. There's a very big difference in a surgery if you're doing just 1,000 grafts versus 5,000 grafts. So that factor is included when it comes to the cost. And clinics will make a bespoke deal for you in order to account for the number of grafts that you need. Lastly, factors that can affect the cost are what technique you decide to go for, whether you're going for FUT, for FUE or DHI. FUT tends to be on the cheaper side of things, but of course we've gone through some of the issues that can have before. FUE is quite middle of the pack, and DHI tends to be on the more expensive side of the scale. So let's talk about some of the different techniques. And really, there are 3 major techniques in use today. There's firstly FUT, which stands for follicular unit tract, TRACT. There's the second one is FUE, which is follicular unit extraction or excisions. And thirdly, is DHI, which is direct hair implantation, or as I like to call it, FUE with extra steps. Let's go through these different techniques and see what the differences are, where the advantages, the disadvantages are for each different technique. Starting off with FUT. So FUT is probably the oldest technique that we use, was the original one that we used for probably a few decades by this point. And essentially what that involves is that we cut a whole strip of skin from the back of the head in the donor area. And from that strip of skin, we then separate out each hair or each graft manually using small scalpels or small blades. And that gives us our total amount of grafts. And then those grafts are placed into the head through incisions made by either a sapphire blade or a steel blade beforehand. Where FUT can actually be pretty useful is that compared to the other techniques, FUT can actually achieve a higher graft count. Because you're taking a whole strip of skin, typically you can extract about 4, 5, 6,000 in one go, which is higher than you can usually do using FUE. And we'll come on to that a little bit later. So FUT can be pretty good for those people that have pretty advanced hair loss or are looking for extreme density. But what are the negatives of FUT and why do we not use it so much anymore? I'm pretty sure over 90% of people doing hair transplants nowadays are using the FUE method and not the FUT method. But one of the main disadvantages is due to the method itself, where we cut out that strip of skin. And that stitching of that line can end up leaving a linear scar. And there'll be some pictures to show you of FUT can look like. Usually it's a large scar going from one side of the back of the head to the other side. And it can be quite obvious, which means you're almost forced to wear your hair long in order to cover that scar, which isn't for most people. Some people want to keep shorter hair at the back. The other disadvantages can be if the stitching is done too tightly, then this can cause some residual pains and headaches in the back of the head as well, and can lead to long-term migraines and things of that nature. Also, removing a whole strip of skin increases the infection risk as well. And it's only for certain patients. So really the patients that can have FUT are ones that have very good laxity in the back of the head. Laxity meaning the give or the flexibility of the skin in the back of the head. And to check for good laxity, you would want to grab some of your hair and just move it up and down. And you should be able to move it a couple of centimeters or so up and down. Move the skin, that is, not just the hair. If you can move that a few centimeters up and down, then you've actually got pretty good laxity. You've got extra skin there to use, so your results won't be as bad. You wouldn't really suffer from the headaches and things like that. But if your skin is very, very tight and you can't move so much, FUT is not for you. Let's talk about FUE. And FUE is primarily the method that I use, and it's probably the method that majority of surgeons in the world are using currently in order to perform hair transplants. And there's some good reasons for why, but let's go through how it works. So FUE, follicular unit extractions, actually involves using a precise micro punch tool. It's a little circular drill, usually about 0.7 to 0.8 millimeters thick. And what that does is punches out each individual graft one by one. So you get all these really tiny dots and really small holes in the back of your head straight after extraction. But these holes, because they're so small, tend to heal really, really well. And actually the results can be almost invisible in terms of scarring after the procedure. But I'll come on to where the scarring can actually be worse. But using this precise micro tool means we don't need to cut a whole strip of skin out. So you get rid of that risk of things like headaches and tightness of the skin afterwards, and that big scar. That's the main draw for most people, is that you don't get that really big linear scar after. Now, using this precise micro punch, you extract these hairs, then you implant them the same way that you would do with FUT, where you make small incisions in the head, and then you place each graft individually into the small incisions in order to cover the area. Let's go for some drawbacks of FUE. So FUE typically can't achieve as many grafts in one go versus FUT. Well, actually, I should probably clarify. It can, but it does depend on the level of scarring you're willing to accept. And some surgeons will not probably explain this to you very well, and they'll take way too many grafts in one go, and you get pretty bad scarring as a result. Usually, depending on donor area, the maximum you want to take in one session is approximately 4,000, and not much more than that. If you go on and take more than 4,000, you start ending up with small scars. And I'll explain this on a piece of paper, actually. Well, imagine this is your donor area on the back of the head, okay? It doesn't exactly look like this, but let's say that this is your donor area. Well, the donor area can only be a certain size. You can't really make it bigger. Now, if we're doing a certain number of grafts, ideally what you'd want to do is extract the grafts so that there's enough skin in between that it would heal up quite nicely. So you'd want good spacing between the grafts. However, let's say we're doing 5,000 grafts or 6,000 grafts using FUE, and we're trying to take it from the same size donor area. Well, then the way we're going to do that is we have to go a lot closer together, like this, versus that. When you do that, in the healing process, these small holes that are made can actually sometimes connect, and they can become a large scar along those lines. When you get a scar like that, it doesn't regrow hair in that area, and that means it looks pretty bad overall. and that can lead to really big scars over the entire area, which gives you a worse result in the long term. So overall, the pros of FUE involve minimal scarring, faster healing, and a more natural look in terms of scarring at the back of the head, where it can be almost invisible if done correctly. But what are the drawbacks? Typically, FUE tends to be a little bit more expensive because of the precision and the time involved. The graft count can't be as high really as FUT, otherwise you run into issues with scarring and things of that nature. And the procedure time tends to take a bit longer. Whereas FUT, you can really get it done in about 6 hours or so. FUE typically is taking 7, 8 or more hours, depending on the number of grafts that you're trying to use. Now let's talk about DHI. So DHI is a little bit of the new kid on the block, but in my opinion, doesn't really offer significant benefits over the current way of doing things. That might be changing in the future. So the reason I call it FUE with extra steps is because the method of extraction is exactly the same. In both methods, you're still using a micro punch tool in order to extract each graft individually from the donor area. So there's no difference there at all. However, where the difference comes between these two methods is in the implantation stage. So with FUE, first you would make some incisions using a blade, either made of sapphire or a steel cut blade. You make small incisions and then you place the grafts inside after the incisions are done. With DHI, you're kind of combining those two steps into one movement. You have a special pen. There's a few different ones out there. One of them is called the CHOI, C-H-O-I, implanter pen, where you load the graft into the DHI or into the pen, and then that pen makes the incision and deposits the graft in the same movement. So some of the advantages for DHI over FUE are the fact that grafts spend less time outside of the skin because you don't need to wait for incisions to be made first, so you can extract and then immediately start the implantation process. This increases the follicle viability, which tends to mean that more of the follicles do take afterwards and you get a better result. The incisions themselves, because they're done in the same movement, they actually tend to be a little bit smaller than using incisions with a sapphire blade or a steel cut blade, and this tends to be better in terms of healing and scarring on the recipient area, and it tends to be pretty good when using it for hairline work. We're doing very, very dense and very, very precise incisions at the front of the head. Now, what are some of the drawbacks, some of the cons of using DHI are the fact that actually it takes much longer to do because you have to load each graft individually into the pen first. This means that typically you can't do as many grafts in a single session unless you're willing to stay there for 24 hours. So really up to 3,000 grafts is recommended. More than that is a really large labor and a long surgery time in order to do so. Another thing is you do need highly skilled surgeons and highly skilled technicians in order to perform that procedure as well. So not every clinic is going to have the capability of performing that type of procedure. Where DHI is pretty good for are the smaller areas, not actually the scalp when it comes to hair transplants. Things like doing the eyebrow, the beard area, and the hairline are pretty good targets to use for DHI. Now, where I have a little bit of an issue when it comes to the marketing for DHI is actually the marketing really goes into less scarring in the back of the head, the donor area, and actually faster healing and an improvement in the donor area versus FUE versus FUT. Now, that is true for FUT because FUT, remember, takes the whole strip of skin. But remember what I said earlier, FUE and DHI have the exact same method of extraction in the first place, taking it out from the back of the head. So with that exact same method, there is no difference when it comes to healing, trauma, scarring in the donor area itself. This is where sometimes I have a little bit of an issue with the marketing for DHI because it is heavily promoted to be a more natural look and less scarring overall, but this is simply not true. So what is the effectiveness of a hair transplant procedure? It does depend on a number of factors, and really that comes down to the skill of the surgeon, the skill of the surgical team, the reputation of the clinic, and the aftercare provided as well. Let's talk a little bit about the factors that actually make a difference. So like I mentioned a couple of times, the skill of the surgeon, the way those incisions are made, the depth, the rotation, the angle, and the density makes a big difference. One of the ones is actually not going too dense, surprisingly. There's an easy way of understanding it. Let's say you've got a limited amount of food, there's 100 people, you have enough food to comfortably feed 100 people. Great. But let's say instead of 100 people, there's 1,000 people there, and you've got the same amount of food. And if you spread it equally, the problem is everyone's going to be having less food, everyone's going to be starving. And that's kind of the same issue we have when it comes to the blood supply for the new follicles. If you go way too dense, there's only a limited amount of blood supply in that area. And if you're trying to put too many follicles in, then each follicle itself ends up getting less than what it actually needs, and this means it doesn't grow very well. You do need to produce the correct amount of density, which for a hair transplant is going to be anywhere between 10 to 30 follicular units per centimeter squared. For comparison, natural hair can go anywhere between 30 to 80 follicular units per centimeter squared. So it does almost reach natural hair levels of density. If you are interested in seeing a video of actually the procedure being done by myself, then click the link on this side. That will actually take you to a video that does show that hair transplant in its entirety on a real live patient performed by myself, and you can sort of see before and after and see how it goes. Another thing that's going to effectiveness is the reason why you have hair loss in the first place. So if you have have normal, what we call androgenic alopecia, which is male pattern hair loss, or even female pattern hair loss because of certain conditions, then you'll probably get a good result. But if your hair loss is caused by another disease process, something like chemotherapy, hypo or hyperthyroidism, infections in the skin, things like psoriasis and eczema, and there's many more, then unless that disease or that condition is in control, stabilized or cured or sorted out beforehand, then the likely result of the hair transplant will not be as good, and more of the transplanted follicles will not take or will not grow afterwards, and it won't be as good as a result as you may have been hoping for. Now let's talk a little bit about the recovery and aftercare process. So recovery is actually pretty quick for a hair transplant, believe it or not. Although it's a big surgery on your head, it takes a whole day to do, it only really needs a few days afterwards to kind of get back to a normal level. Within 2 to 3 days, you're sort of back to normal life in a way. But you still need to be very gentle and wash properly for the first 2 weeks. So that full recovery is the first 2 weeks. But let's go through step by step what to do. The first 2 to 3 days, I can't stress it enough, you should be extremely careful with these new grafts. That's because those grafts, they're not stitched in, they're not glued into place, they're just sitting inside of the incisions and they're just hanging out in that space, which means they can very easily pop out. So if you're a bit too gung-ho, you try and play football the next day and you headed a ball or something, then your grafts will come out, they'll be stuck on the ball and you will lose those grafts, and obviously they will not be growing in that area. Same as if you're bending down too much or doing heavy exercise, that movement can actually dislodge those grafts in the first few days. So ideally what you would do for the first couple of days is pretty much stay in bed, not doing anything at home. Just watch TV or read a book. It's a bit boring for 48 hours straight. It is best for the survival of the grafts themselves. After a couple of days, those grafts are a little bit more set in the area, so you can get up and walk around and do some light exercise. It's not a problem. But at that point, you really need to concentrate on washing it properly, because another thing that can go wrong is the infection rates. Typically, infection rates are quite rare after a hair transplant surgery. But of course, with any surgical procedure, infections can happen, and they are a complication that can happen after surgery. So you do want to wash it regularly, you want to keep it clean. In terms of washing, you're not going to use a shower head straight after, because that water comes out way too fast and it will dislodge those grafts. So unless you've got a low pressure shower head where it's just sort of like a tap just dropping on your head, then what you'd want to do is actually wash it manually yourself by taking some shampoo. You can foam it up by mixing with a bit of water, using that foam just to put it on top, soak the new hair follicles, and then you want to rinse it off with a bowl or a jug of water. That's the best way in order to wash that hair. Same for the donor area. Although the donor area, you can be a little bit more gung-ho because there's no follicles to worry about, so you can sort of wash it like normal. But again, don't use a shower because that'll be quite painful straight after surgery. If you follow that washing process, keep it clean, look after it, then after about 2 weeks, you're pretty much back to normal life. If someone told me that they want to go breakdancing and spin on their head, on day 13 or day 14, I'd probably tell that person off. On day 15 or 16, I'll be a lot more open to it. So really that 2 weeks time period, pretty important. After that, you can shower like normal, you can do some light exercise, and you can pretty much have a normal life. Light exercise you can do after 2 weeks. That means a light jog, some gentle weights, things like that. Heavy exercise like a sprint, a marathon, playing sports, things of that nature after 4 weeks. Another thing that really confuses people in the aftercare, the recovery process, is the hair shedding. So the way to explain this is that the follicular units are the things we're after when it comes to a hair transplant. We're not actually transplanting hair, we're transplanting follicles. Follicles are what grow the hair. They're the growing mechanism for the hair to come out. So the hair itself is actually not really important there. It's the follicle. Now the follicle is deep inside the skin. You don't usually see it on the surface of the skin at all, but you do see the hair. As surgeons, actually, we can't really see the follicle because it is skin colored. So we target the hair. Once we've removed that follicle from your head, then actually the hair inside is dead. Once we put it back in, that hair is still dead there. So the first thing the follicle needs to do is actually remove that old dead hair before it can start growing new hair. That hair shedding process starts as early as 7 days after, but usually around about the month mark, people will notice that their hair tends to fall off and is shedding. And at that point, it's basically gone back to where you were before the transplant has been done. This is where most people get anxious, get stressed out. I call this period, the first 3 months, I call it the ugly duckling phase, because you're not going to look great. It's going to look obvious that you've had a hair transplant. The skin will still be a little bit red. You sort of have to go through this part. But once you get to around that 3-month mark, all of the new follicles will have started growing new hair, and actually the result is starting to come through. Some points to keep in mind when it comes to the aftercare process is, to be honest, pain is not usually an issue that people complain of after surgery. The most you'll be expecting to feel in terms of pain is probably a small headache, which paracetamol is usually enough to take care of. What a lot of people do complain of, unfortunately, is the itching. It does get a little bit itchy, both in the donor area and the new hair transplanted area. The reason for that itching is primarily because of dryness, and dryness happens because of the inflammation in the area due to the amount of surgery, due to the trauma of being incised and extracted. skin. So that inflammation causes dryness, that dryness causes itching. Best way to deal with that itching then is to keep the area cool and wet. And we do provide a bit of a spray, and any clinic does usually provide a bit of a spray, which is just normal saline meaning water mixed with a bit of salt. And that usually helps keep the area quite nice and wet, and that helps a lot of the itching. But medications like antihistamines or allergy tablets are pretty good at controlling itching as well. Paracetamol for the headache, and there shouldn't be too much else you need to use. In terms of aftercare, it's very important that you also take antibiotics after surgery as well. Your surgeon should put an antibiotic cream on the donor area where they've extracted. That would help prevent any infections. And most clinics will be giving you antibiotics to take for about 5 days afterwards in order to prevent any infection turning up, because an infection can unfortunately ruin the results if it turns up too early. So that was a lot of information. It was a bit of a whistle-stop tour of hair transplants in total, but I hope I've given you some good information about what a hair transplant is, different techniques, how it works, what the expected result can be, and the sort of costing schedule, costing procedure for that. I'm saying over 90% of people are probably good candidates for a hair transplant. And you shouldn't wait too long, because the more that balding, the more that hair loss goes on, the harder the job is to actually get it sorted in the future. And lastly, as a final thought, very important, don't discount the role of medications like minoxidil and finasteride in your hair loss journey. Minoxidil works by helping the hair to stay more in the anagen phase, which is the growth phase of the hair, and therefore causes regrowth of hair, whereas finasteride lowers DHT, dihydrotestosterone concentration, in the skin. That stops hair from going away. So the easy way to remember is finasteride stops it from leaving, minoxidil brings it back. Using them together is a very good combination when it comes to hair growth. A hair transplant will put hair where there is no hair, but medications will save the hair that you've got. So a combination of those is usually the best way forward. If you want more information about that topic when it comes to medications and so on, then click the link over here. We're going to make another video that explains all of that in detail. Now, you know how it is on YouTube. I've got to do a bit of a plug. So my clinic, Royal Wolf Clinic, we perform hair transplant surgeries. I am the chief surgeon there. My name is Dr. Shaan, medical director, and I'm a GMC licensed doctor in the UK. Now, if you're interested in getting one done, then feel free to call the number that's provided in the description below. There's also a website there if you want some more information, or if you want to book a free consultation with myself regarding your hair loss, then also follow the link there. You'll be able to get yourself booked in. And don't forget to subscribe for more information regarding hair transplants, regarding hair loss in general, to see what can be done for your journey.